Do you find billing chronic care management or CCM services challenging? Are you receiving claim denials and overpayment requests? Don't worry, we got you. Today we're going to share how to avoid common claim errors for chronic care management services so you can get paid right the first time. In this video, we'll look at what makes up CCM, how to tell if a patient is eligible, what you need in your patient's medical records, and most important, getting paid right the first time. We'll answer these questions. What is meant by chronic care management? Who can perform CCM services? How does a patient qualify? What's involved in CCM? What documentation should you maintain for Medicare audits? What can you do if Medicare asks for your money back? And where can you find guidelines to help you get it right the first time? We'll answer these questions, walk through an example, and review how to document your time for a CCM claim. First off, what is meant by chronic care management? CCM is a critical component to better healthcare outcomes for patients because it reduces overall cost of care and creates a savings to the Medicare Trust Fund, while maintaining continuity of care. For this topic, we'll focus on current procedural terminology, or CPT, code 99490. This is the code billed for basic non-complex CCM and the most problematic. As defined by CPT code 99490, basic chronic care management are non-face-to-face services of at least 20 minutes of non-complex clinical staff time per calendar month, which is directed by a physician or non-physician practitioner. These are services for patients with 2 or more chronic conditions that are expected to last at least 12 months or until death, which places the patient at significant risk of death, acute exacerbation, decompensation, or functional decline. So, who can perform CCM services? Eligible reporting practitioners called EPs include the following: physicians, physician assistants, clinical nurse specialists, nurse practitioners, certified nurse midwives, and finally, rural health clinics, federally qualified health centers, and outpatient hospitals, which include critical access hospitals. CCM is usually billed by primary care practitioners. In certain circumstances, specialty practitioners may provide and bill for CCM. However, CCM services are not within the scope of practice of limited licensed physicians and practitioners, such as clinical psychologists, podiatrists, or dentists, although you may refer or consult with such providers to coordinate and manage care. Because CCM involves monitoring all of a patient's chronic conditions, only one practitioner or one hospital can report CCM per month. CCM services not personally provided by a billing practitioner should be provided by clinical staff under the direction of the billing practitioner as Incident 2, which is subject to applicable state laws, licensure, and scope of practice. Clinical staff are employees of staff working under contract for the billing practitioner. So how does a patient qualify? As stated in the CPT definition, to qualify for CCM, beneficiaries must have at least 2 or more chronic conditions lasting at least 12 months or until death and placing them at significant risk of death, acute exacerbation, or functional decline. There are no other diagnostic limitations. All chronic conditions considered by the provider must be documented as a diagnosis in the medical record and submitted on the claim. The patient's acceptance and awareness of this arrangement must be documented, along with additional specific points regarding CCM. A verbal rather than written consent is allowed. However, the consent must still be documented in the medical record. So, let's look at what's involved in chronic care management. With CCM, the beneficiary will receive either non-complex or complex CCM for a given month. This includes activities such as patient education or motivational counseling, which is frequently provided to patients either in person or non-face-to-face, usually by phone. During CCM, a comprehensive care plan is established, implemented, revised, or monitored as well. If the provider recommends a patient receive certain services in person or believes they would benefit or engage more in person, the provider may still count this as billable time. Nevertheless, in all cases, time and effort cannot count towards any other service if it is specifically for CCM. Let's work an example. A patient is being seen for multiple chronic conditions and agrees to receive CCM. Keep in mind, the initiating visit which isn't covered here, would be separately billable. So, what's required to be performed for CCM services? A comprehensive care plan addressing the patient's chronic condition should be created. A copy of the care plan should be provided to the patient and made accessible 24 hours a day, 7 days a week via electronic means. Over the next few days, clinical staff may make several phone calls to coordinate efforts with other practitioners regarding the patient's multiple conditions. Make sure clinical staff log the number of minutes each phone call or outreach contact lasts, to whom they speak, and the content of how the call relates to the patient's conditions. Once 20 minutes of time has accumulated towards the patient's CCM services, the services can be billed for that month. Keep in mind, there may be more time or complexity to a patient's CCM. CPT code 99490 addresses only non-complex services. So, how do you document these non-face-to-face services? What should you maintain in the records in case of Medicare audits? First, let's look at the Comprehensive Care Management Plan. This is an electronic patient-centered care plan tracking all health issues of the patient. The electronic care plan should be periodically reviewed and updated. This ensures receipt of preventative services, as well as proper management and reconciliation of medication. It's also used to coordinate home and community-based clinical services to benefit the patient. The plan of care typically includes, but is not limited to, what you see here: detailed chronic problem list, expected outcomes and prognosis, measurable treatment goals, symptom management, planned interventions, medication management, community social services, how services of agencies and specialists will be directed and coordinated, individuals responsible for each intervention, requirements for periodic review and revision of care plan. Additionally, Medicare requires use of Certified Electronic Health Record, or EHR technology, to satisfy certain elements of CCM and the Comprehensive Care Plan. Medicare expects providers to show the full list of problems, medications, and allergies in the EHR to assist in the patient's care management. Next, as mentioned, the services are timed. 20 minutes or more of clinical staff or physician time performing qualifying activities is required per month. This is the threshold amount of time. Each contact or call made should be entered in the medical record with the credentials of the person and the amount of time spent making that contact. Also, chronic care management is covered under general supervision for Medicare. This means when a service is not personally performed by the billing practitioner, it is to be performed under his or her overall direction, but they're not required to be physically present. During a given month, all time spent on CCM services directly by the billing practitioner or clinical staff counts towards the required threshold time. However, non-clinical staff time cannot count towards the threshold. So, what are some of the issues we're seeing? Most, if not all, errors are because of the insufficient documentation, either missing requirements or missing completely. The top items missing are a copy of the electronic comprehensive care plan indicating 24/7 access is available and a copy was given to the beneficiary or their caregiver. Documentation supporting at least 20 minutes of CCM services for the billed month. Copy of the patient agreement or documented consent for CCM services. Be sure to avoid any issues and ensure these elements are included in the medical records for patients receiving chronic care. Now, what if they aren't included? What do you do if Medicare asks for your money back? If a Medicare contractor asks for documentation and follow-ups with a request for overpayment, you can always appeal the decision. Submit your appeal with any additional documentation related to the services or explain any gaps in documentation. Most important, work now to confirm you have what's needed in medical records to ensure that never happens. So, where can you find guidelines to help you get it right the first time? Medicare has an excellent care management resources webpage that provides the CCM guidelines and additional resources to help with documenting these services. Finally, if you follow these steps we've outlined, you can be confident your patients are getting supportive care, be confident you'll get paid for these services, and be confident if Medicare asks for documentation, you are ready. We hope you learned more about avoiding common claim errors for chronic care management services so you can get paid right the first time. You can visit our website for more resources and to check out our other educational videos. And as always, thanks for watching.